Hello, my name is Anders Nijsum and I am the CEO and co-founder of Visikon. Visikon is a Danish company on a mission. We want everyone on earth to understand their health communication. That is why we have built a highly scalable digital platform named MyTreatment. MyTreatment transforms complex communication into a visual language everyone can understand. This is so important because we know from studies that poorly informed patients are associated with poorer health outcomes. And we know unprepared and nervous patients are also expensive patients, leaving huge costs for the healthcare industry. From research, we know almost 50% of adults do not understand the written healthcare information very well. This is an authentic photo of the information given to patients undergoing bowel cancer surgery at a university hospital in Denmark a few years ago. Our answer to this huge challenge is a completely new approach. We make difficult and abstract information easy to understand, and we prepare patients to the reality of the hospital by replacing a scary or wrong imagination with simple and correct images of what is going to happen. Let me give the word to our friend Joseph, who will introduce you to the MyTreatment app.
MyTreatment is an app for you who are facing treatment at a hospital. It gives you a complete overview of your treatment plan, and it uses a unique visual language to explain and prepare you for everything that will happen before, during, and after your treatment. It also contains rehabilitation programs, training journals, and detailed information about your specific treatment. When you're back home from the hospital, the symptom guide will support you on how to safely respond to your conditions, and the FAQ will help answer all the most important questions. MyTreatment will automatically remind you of important and relevant tasks when it's the right time, so you're well prepared for the next step. MyTreatment supports multiple languages, and you can share your treatment program with your family, also at a distance, so they know what you're going through and can be prepared to support you. Ask at your hospital or clinic if the MyTreatment app is available for you.
MyTreatment is very easy to implement at the hospital as a plug-and-play solution for each department. MyTreatment is sold to the hospital on a volume-based subscription. It is always adapted to local settings using Visikon's digital editor, and the service includes yearly updates on clinical content. MyTreatment is born out of research, and early studies showed a significant impact on not only the patient's level of pre-operative anxiety, but also the anxiety level of the patient's support person. The cost reductions in a study with patients going through total hip replacement were calculated by a health economist to be €768 as an average per patient. This is without increase in adverse effects and no change in patient perceived quality of care. In a recent project, a client did a study on the time consumption of nurses helping patients with self-care before and after the implementation of MyTreatment. As you can see, the time with each patient was reduced significantly. And this is the general experience. We help hospitals to prepare and empower the patients. It benefits the hospitals by reducing cost, and we also see an increased patient experience quality. We can measure that they actually feel more included and involved in their treatment, even though they learn to do more of the work by themselves. We are proud to have received several awards for MyTreatment, like a Danish and a German Design Award, and a hospital staff award from the largest hospital in Copenhagen. MyTreatment is currently in service on several departments at 13 hospitals in Denmark, 4 of them being the main university hospitals. It is being used with all kinds of procedures within cardiology, urology, obstetrics, orthopedic surgery, general surgery, breast cancer, plastic surgery, etc. Our general business case is simple. Most of the clinical procedures are similar all over the world, following the same international guidelines. Health literacy is a global challenge, and animation is a language that knows no borders. And here is another secret. We are a very diverse team of passionate professionals working closely together. Doctors, nurses, software engineers, animators and designers and business developers. This creates not only a unique atmosphere of curiosity, but I humbly believe This is the key to how we will succeed with our vision. Our goal this year is to get our first client here in the United States. If anyone in the audience is from a surgical department or hospital management, don't hesitate to contact me so we can have a chat later. We also want to quit bootstrapping and get some financial muscles. So we are now opening up for dialogues with investors and possible financial partners to help us building a strong business while creating more equality in health on a big scale. And this leads to my final story. Parallel to building my treatment, we have also helped build a global mHealth solution called Safe Delivery App. Safe Delivery App is an evidence-based tool that educates healthcare workers on how to manage emergency situations within pregnancy and childbirth. It is in use in many countries. In India, it has recently been rolled out to 2,000 health clinics. And this scalability is a proof of concept that our idea of a global visual language for health communication is possible. Thank you very much for listening. It has been a pleasure. I hope to meet some of you out there in real life someday. Take care. Bye.